Well, welcome to this month's CCI video update highlighting the great work of schools and school districts around the state of Indiana who have received a Comprehensive Counseling Initiative grant from Lilly Endowment. I'm Matt Fleck, and today our guest is Chris Duzenbery. I should say Dr. Chris Duzenbery with MSD of Decatur Township in Indianapolis. Welcome, Chris, or welcome back.
Well, thank you, Matt. I'm pleased to be here.
Good. Chris was one of our very first interviewee in the Comprehensive Counseling Initiative video series, monthly video series. So Lilly Endowment said, let's get Chris back on and talk with her and kind of get an update on what's going on. So we're really pleased that you agreed to do this. So Chris, I'm going to ask you first about your district's comprehensive counseling model. I know that you selected the Ask a National model to initiate. Can you give us an update how that's going and what progress you've made so far?
Sure. Actually, we did adopt the Ask a National model, and for about the first 3 years, or the last 3 years that we've been working through this process, we have been implementing steps of the model, and we really started first with the program focus and created our vision and mission statements and the beliefs for the school counseling program. And now we've fully implemented about 7 out of the 8 program planning components, with the last one that we've been working on this year as our focus being the creation of action plans. This has been the most difficult one to be able to tackle. The classroom, the group, the closing the gap action plans, and this past school year, as everyone knows, has been really challenging all in itself without trying to implement any kind of new process or procedure. But just in the short times that we had with students in the classroom, even on our hybrid schedule, we really tried hard to focus on that particular programming component. So really, starting next school year, we will have been able to implement everything, and we intend to apply for ramp status in October of next school year.
Wonderful. Yeah, it's a challenge, isn't it? It's not an easy list of things to put together for the Ask a National, at least for ramp application.
Right.
You said the action plans were a challenge. Is it mainly the data, figuring out what to focus on, or the data collection, or some combination of both?
I think it's a combination of things. And I think that just because of the way that our school counseling program was structured in the past, with a small number of counselors trying to serve a large number of students, we rarely were able to do anything when it came to classroom lessons or even small group, let alone any kind of focuses on special groups for closing the gap. So this past school year, we were fully staffed with 5 school counselors at Decatur Central. We have 5 small learning communities, so each one of the counselors was able to focus on about 350 kids on their caseload, which, for the Ask a National model still is a high ratio, but compared to the 500 to 700 that they were facing in the past, it was amazingly different. So just getting used to the fact that they had a lot different structure that they could now work under, they just had to get their feet under them and try to figure out how it worked.
Yeah. What were some of the challenges that you faced and that you had to overcome in adopting this comprehensive counseling model?
Really, I think early on, one of the challenges was really part of this, the ramp piece, when we're looking at all the different components that we want to try to meet with the program planning. And one was the school data summary. It was a big lift to begin with, just being able to try to find all the data, trying to extract it from a variety of different sources, getting a lot of different people to help us. But once we established that baseline, got our first set of data, and figured out where to get it and how to get it, then it was much easier to update annually. And then I think another challenge initially, this is probably very common for a lot of schools, was to implement the annual administrative conference. It was very new, and when we first started the process, because there wasn't a whole lot of conversation taking place between the school counselors and administrators in the building, and the administrators were definitely not familiar with the ASCA model. So the process of discussing goals and use of time and all of those things were very different for them to even start those conversations or have them with a school counselor. But one thing we decided to do the very first year we did the administrative conference was all of the counselors met with the administrators as a group at the high school level. And they had one administrative agreement, if you want to call it that they submitted and worked with the administrators through, and kind of did that as a group so they wouldn't feel intimidated, and that it worked wonderfully. And the administrators too, because they were a little overwhelmed with the whole process. And then since then, in the following years, each counselor's conducted his or her own conference with the administrator that supervises them and evaluates them.
It's one of the, I think, most important aspects of the model, just to have that conversation with leadership. It's a learning experience, I think, for both the counselors and for the administrators. And it can be one of those things that fosters more support, definitely more understanding of what counselors do.
Oh, absolutely. It made probably one of the biggest differences of any part of the model that was implemented when you really think about it, because once those discussions started to take place and more appropriate duties and responsibilities were then assigned to the counselors, their use of time was amazingly different. I mean, they were able to serve students with direct services a lot more of their time. And, just thinking about time, there's a couple things that I noted to myself when I was thinking about these challenges, and this is probably nothing new to anyone else either, but, when you're trying to affirm or at least substantiate what you do as a school counselor, being able to track your use of time is pretty important, and being able to show others in leadership roles or those that supervise you what you actually do with your time is extremely important. So it was a bit of a challenge to begin with, to be able to try to find the best ways or to use tools to track the use of time. But I think once different counselors got into routines and the process for themselves that they started to work with and found to be useful, that started to become a lot easier. And then really the final challenge I noted was the use of a weekly calendar. And I think everyone can relate to this, that once you put something on your calendar, you have a nice plan, but as soon as the first crises erupt, it just gets blown out of water. So it never really fails that, you get pulled to do other things. It kind of blows up your plan. And I think still to today, the counselors have a little bit of a hard time maintaining that weekly calendar to a degree of integrity in terms of what they intended for their plan to be.
Yeah, best laid plans. It's especially true in a school counseling office that what you attempt, or at least what you plan, may not come through that week. So interesting. Yeah, let's, on the kind of a broader perspective, just the overall comprehensive counseling initiative and that grant and all of the other strategies that you had in place. What stands out for you? What's a memorable aspect as you're coming to your last year? So anything that stands out that has been a success for you?
Well, I got to thinking about this when you had posed some of the questions to me. During the planning phase, it really was a pretty memorable time in terms of us being able to travel, do some research of exemplary programming, be able to to attend some conferences and really get our foothold on some really solid professional development. I mean, really, that was amazing. You know, those opportunities at the very beginning of the process. And then being able to participate in things like the Hatching Results Academy, and I know you were there participating in that. That was pretty life-changing, actually, in terms of being able to understand the bigger, broader picture that we were working toward. And then, you know, I thought of a couple of other things that I know that other counselors are probably working toward if they haven't already tried this. But our very first school board flashlight presentation was amazing. It was really great to be able to see the counselors express and show the school board, you know, what they've been up to and how they were able to make some significant differences, you know, with the work that they do. And then our first advisory council meeting was just as rewarding. So those, I mean, I know it's not a thing, it's definitely a toss-up between several things when I think back over those aspects.
Wonderful. More than one thing is always good. More than one positive thing is a good thing. And just for those of you who don't know, the flashlight presentation is something that Trish Hatch started years ago. It's basically a summary, a data summary of progress you're making with your school counseling program in a kind of colorful, artsy, graphical way. And it sounds like it was very effective, at least for your school board.
Yes.
What would you change about your initiative? What would you do differently if you could, now that you've known what you've learned?
Well, I've thought about this a lot because if I were to do everything all over again, I think I would work much more closely with the administrators in the district and really try to front load a lot of the professional development and take a really deep dive into the ASCA model instead of just kind of releasing, you know, the gradual release of information over time. Just really dive deep into making sure the administrators were well versed in exactly what the counselors were working toward, so they would be prepped and more informed and really ready to pave the way for the transformation that we were setting up to do in the whole school counseling program. I mean, that's working with the administrators. That's the key.
Yeah. Good idea. Okay. That gave me a couple of ideas there. You also worked with your partners in the community. How important was it to have collaborative partners?
Oh, holy cow. That we could not have done what we have accomplished without them. And two of our partners were part of one of our main goals for our actual grant, which was to basically create a system of support for our students. So we enlisted the help of communities and schools, CIS for short. Mm-hmm. They actually place site coordinators in schools that they partner with that act sort of like social workers. And they're able to help connect families with resources. And they do a needs assessment within the school and determine for each individual school where they're placed, what are the exact needs for that school. And our site coordinators really helped a lot with attendance and being able to work with chronic attendance problems. And then obviously connecting families with basic needs and resources of that nature. And that just helps take those kinds of duties off the plates of the counselor so they can serve the students more with direct services. And then having another partner that fed into that kind of triad between school counselors, the CIS, was Cummins Behavioral Health Systems. And having more contracted service hours with them as the on-site school provided health or mental health services allowed us to specialize in some small group sessions, allow some students to have some counseling opportunities that they wouldn't be able to have because they didn't qualify for insurance. And, you know, when they were able to do some small group sessions, that helped our counselors tremendously because they didn't have the time necessarily always to be able to facilitate those small groups.
I know that you are retiring this year, and you are also an administrator over counselors and have for many years. not a school counselor yourself, so you have a unique perspective on all of this. So what's your perspective in a more even broader sense of school counseling? Where do you think the profession is headed?
Well, I think since the school counseling, comprehensive school counseling grant was initiated by Lilly, it has transformed many, many, many schools, I mean, across the state. And I think that even the schools that weren't recipients of the grant have benefited from those who have been, because they've, different counselors have served on different committees with folks that have been part of the grants, or they've seen them or worked with them outside of their schools and that sort of thing. And it seems like the focus that has been put on school counseling has really allowed that spotlight to be put on a counselor for the purposes that they were intended to serve to begin with, and that's the three domains of counseling. Instead of being the utility player, which they still are a utility for their school, but instead of being that utility player that just got saddled with every last little thing that no one else wanted to do, now there is a real laser focus on what school counselors should be doing to begin with. I see school counseling working in tandem, kind of more of a team approach going forward as schools employ more people to help support mental health and social emotional learning, being kind of a system of care, that team approach for the future.
I love your vision. I love that you are optimistic after all you've been through and all of this work. It's so encouraging. Chris, I know this is just a short time, but I thank you so much for giving us an update on what's going on in Decatur Township. I know the good work will continue, even though you will not be there, but I wish you luck and lots of fun in your retirement.
Well, thank you, Matt. And I've always appreciated you being a supporter of our school corporation and in our school counseling department's transformation to our comprehensive counseling initiative and being part of our grant process. So once again, I thank you and Kelly both.
Well, thank you. Well, we'll be in touch. So you haven't got rid of us yet.
Okay.
Well, thanks to Chris Duzenbery, Dr. Chris Duzenbery with Decatur Township for joining us. Thanks to our viewers for watching this monthly CCI video update. We'll see you next time.